Just before the Democratic Party convention, the DNC National Convention Platform Drafting Committee voted down an amendment for a single-payer health care system. The defeated single-payer amendment was supported by presidential candidate Bernie Sanders and numerous labor organizations. Here, the DNC's Clinton-controlled Platform Committee votes the amendment down by 7-6.
On page 21, line 5, we would like to add the following amendment. It is the policy of the Democratic Party that we will put people before profits by fighting for a Medicare for all single-payer health care system to guarantee health care as a right, not as a privilege, to everyone in this country. Working together, we will end the greed of health insurance companies. That's the motion.
Is there a second to Mr. Zogby's?
Second.
There is a second. All those in favor of the motion, please raise your hands. All those opposed? 7-6. 7 against, 6-4.
The Labor Campaign for a Single-Payer criticized the DNC's rejection of the single-payer option. The official platform of the Democratic Party will continue to view health care as a commodity, to be purchased rather than a public good and a fundamental human right. Back in October of 2015, Labor for Single-Payer and other organizations held a rally and national conference in Chicago to advance the campaign to bring about a single-payer healthcare system. National Nurses United Secretary-Treasurer Martha Kuhl was one of the rally speakers.
I'm a registered nurse, and I take care of children with cancer and other serious diseases. I want to concentrate solely on providing those kids the best possible care. I want their parents to be able to concentrate on them 100% too. And without having to constantly worry about how to pay for their care. Parents worry about co-pays, deductibles, co-insurance, out-of-pocket expenses, and all the bills that add up when you have a sick child. Many will agree with me that all children deserve health care. But how can children get health care if their parents don't have it? How can parents provide that care for their kids if they don't have health care? Medicare for all will truly guarantee health care coverage for all of us. Medicare is our success story. We love success stories in America. Medicare will level the playing field. We love level playing fields. Join with us, get involved in the movement, and demand health care as a human right.
Everybody in, nobody out. Everybody in, nobody out.
At the Chicago conference, NNU's Michael Lighty outlined the political context for the single-payer movement in the upcoming 2016 national presidential campaign.
In the 60s, there was a profound upheaval, a social upheaval in this country that Donna and Ben referred to, and Jim McDermott, the civil rights movement, the greatest social movement since World War II, and it still, of course, has unfinished business. But in the midst of that social movement, what happened? The greatest expansion of publicly financed health care in the U.S. ever, Medicare and Medicaid. Now compare that to the moments in 92, 93, and 2009, 2010. All moments of great upheaval for health care. That is, it was a reform moment for health care. There was not the broad social movement, and what we faced was we were basically the single-payer tail wagging in the healthcare reform movement dog. That somebody else decided what was going to do. In 1992, the Democrats abandoned single-payer in their platform. In 1992, the AFL-CIO took a position other than single-payer, and Mrs. Clinton put forward a proposal. She was wrong 20 years ago, 23 years ago, and she's wrong today. Yeah. The presidential candidate and ultimately the president defined the agenda. in 92, 93. And the same happened in 2009, 2010. The grand wizards of the public option decided that was politically viable, so we weren't going to talk about single payer. When we met with Senator Kennedy, he said, hey, I got 11 senators for single payer, so I'm not going to do it. And Barack Obama, of course, adopted an agenda that resulted in the Affordable Care Act. So what is the difference between 1965 and those other two periods? The difference is, A, there was a movement that demanded change, and that movement had a direct impact on what the president put forward. We are in that position today. So when you ask yourself, what can I do for single payer? Look at the 74-year-old white guy who's running around the country every time he ends a speech or talks a speech and he says, we have a healthcare as a right and I want improved Medicare for all. That's what we can do. We can help that guy. And we have to understand what, in the broader context, what the fight is about. And ultimately the fight is about the role of government. And if the fight is about the role of government, it is inherently political. It is not going to be enough to have the winning policy argument. We have to engage politically in a way that takes on the power that is opposed to us. So when we build this movement, we got to understand the political moment we're in, we got to understand the power they're up against, and we got to take every opportunity to build that movement. And right now, if the Medicare for All candidate wins Iowa, wins New Hampshire, wins Nevada, and wins South Carolina, then we will be on our way to single payer in this country in a whole new way than we've ever been.
Labor Beat asked NNU's Martha Kuhl, what would her union strategy be for single payer if the Democratic Party nomination went to Hillary Clinton instead of Bernie Sanders?
If he doesn't win the nomination, I think he said that he will continue to stay within the Democratic Party and presumably would support Hillary, or is that clear? And what do you think of that?
He may have said that, but my point of view and National Nurses United point of view would be that we're building a movement for social change to achieve social and economic justice, and that movement can't stop if he ends up not in the campaign. We will have to hold every elected politician accountable for their positions that harm all of us or their positions that help advance all of our interests and make our society more just.
Following is a more detailed critique of the current system under the Affordable Care Act, or Obamacare, given in 2014. Dr. Andrew Coates, MD, sees single payer as the obvious solution.
For most of us in the United States, the idea that there's a crisis in the healthcare delivery system is not new. The idea that all of us should have access to comprehensive care with no fees at the point of service, no copays, no deductibles. Necessary care is necessary and it should be available to everyone. That idea is something that I think has permeated the whole population. I don't think it's a real controversy. I know that it may be on Fox News. Somebody will say that there's somebody who deserves to die and suffer, but really that's not the mainstream view. This is a data compiled by David Himmelstein and Steffi Woolhandler that I think really gets your attention. The United States spends far, far more per person than any other nation, and that's the total bar at the bottom, that the United States spends almost twice as much as any other nation on health care. But within this slide, the yellow portion of the bar is the public spending. That's the taxpayer money that goes to support health care. So the United States spends more public money per person than any other nation spends in total. And we in PNHP like to call this slide paying for national health insurance but not getting it. So for all of this spectacular spending, we do not get the outcomes. The United States trails the developed world when it comes to life expectancy. This is another way of saying something similar, that when it comes to preventable death, the United States leads the developed world in preventable death. We don't have infant mortality that we can brag about. We lag behind the developed world in infant mortality. Maternal mortality, pregnant women who die in the United States in the last period, in the last decade, the most recently studied decade, maternal mortality actually got worse in the United States. It only got worse in a few other nations, Afghanistan, some sub-Saharan African nations. Maternal mortality in the rest of the world improved, but not in the United States. And we don't have more smokers to say we can't say that we're a sicker population. We don't have more elderly, so we're not older than the rest of the developed world. We don't have more hospital days. We don't have more physician visits than the rest of the developed world. We don't have as many nurses per population. We do have a lot of technological things like hip replacements. We're kind of up there with the leading nations. But U.S. kidney transplant, patients eligible for a kidney transplant are less likely than patients in other developed nations to get a kidney transplant for all of our great technology. And for all of our acute chest pain pathways in every emergency room in this country, we don't have the outcomes when it comes to acute myocardial infarction. We do pretty good on hemorrhagic stroke mortality, a devastating diagnosis. And what do we lead the world in? Overhead, administrative waste. Private health insurance, because of the waste, you could argue, has been falling. The percent of people that were once covered by private health insurance peaked quite a long time ago, about 1980, and it's been falling. And the access to health care insurance has affected all sectors of the population, retirees, veterans. And this is a point that, insurance, access to insurance is still not the same as access to care for all of us. And we should always make that point. Nevertheless, if you have insurance, you're less likely to die. If you control for all other factors, socioeconomic status, health status, about 45,000 people die each year simply because they don't have health insurance. So having health insurance is very important. There's a higher inpatient mortality. If the child is sick enough to get into the hospital, they're more likely to die if they don't have insurance. And yet, if you do have insurance, what we have is this phenomenon of underinsurance. So this is when a significant portion of your out-of-pocket income, your personal finances, have to go to pay for the cost of health care. And in 2003, you see this purple wedge of this pie, about 9% were estimated to spend. I believe the statistic was more than 10% out of pocket in this study, and it nearly doubled by 2010. And it's this shows that if you add the uninsured plus the underinsured together, in Florida and Texas, more than half of adults were underinsured or uninsured. So a spectacular proportion of the population in Florida and Texas, but big in other states too. Look at New York. If you don't have insurance or you're underinsured, you're more likely to have financial stress from the cost of healthcare bills. This is people who skipped needed care. 63% of people without health insurance reported that they skipped needed care. Just less than half who are underinsured skipped needed care. And yet, private health insurance doesn't guarantee access. Private health insurance itself is not care. 28% of people with health insurance still skip needed care. And 27% of people with health insurance still had problems paying a medical bill. A huge proportion of us have money issues when it comes to getting care. The uninsured and the underinsured delay necessary care. Famous in upstate New York is the story of one of our colleagues who had a man come in with chest pain all day. The EKG showed a classic heart attack. The man refused the ambulance because of the cash that would cost his family. He didn't have insurance. The doctor called the family. They found out that eventually they did call an ambulance, but the patient died because of presumably the delay in care. Nursing home care, a personal interest of mine is what happens to families who face that transition from home to the nursing home. Of course, we should have a system, a healthcare delivery system, where people can have a dignified and appropriate existence in their own home with the proper privacy and proper supports. We don't have that. We have this system where there's this jarring transition to a nursing home, and the out-of-pocket payments are significant. Medicaid doesn't quite pick up a third of the cost. Private insurance does pick up a tiny bit, but almost a third, 28% out-of-pocket costs for nursing home. This is more research by PNHP founders Himmelstein and Woolhandler. If you look at the causes of bankruptcy in the United States, the majority of people who go bankrupt in our country go bankrupt because of medical bills. But what this pie chart shows is the percentage of people who have insurance at the outset of their bankrupting illness. So 22% of those bankrupted did not have health insurance. So that means that 78% had some form of health insurance. And look, 3 out of 5 bankrupted by healthcare costs had private health insurance at the outset. And this was a New York Times article last year that just said the cost of healthcare in retirement, the couples should plan on having about $250,000 on hand. This is another take at high copay. So this is a no MD visit within a year for children. So parents who had free care were more likely, you see, age 0 to 4, were more likely to get to the doctor. So these are the ones who didn't get to the doctor. But if you had a 95% copay, which, then you would be much more likely not to take your child to the doctor for that year. High deductible plans, because health care for women tends to cost more. High deductible plans are a pay cut for women because there'll be more out-of-pocket spending on average for women than there will be for men. And this is just the general trend in premiums. Individual plans rising to, by 2012, to over $5,000 for an individual on average for annual premiums, and for a family over $15,000. And so as those costs are out of sight, this squeeze makes us say healthcare reform cannot wait, and it must not wait, and it will not wait another year. $1.2 billion spent on healthcare lobbying. So there was this enormous, enormous race to influence Congress, and the health insurers got what they wanted. A woman called Liz Fowler went from being vice president for public policy for the WellPoint Insurance Company to working for Max Baucus at the Senate Finance Committee and helping to write the law. This was an actual cover of the LANCET, the leading medical journal. The healthcare reform process exposes how corporate influence renders the U.S. government incapable of making policy on the basis of evidence and the public trust. So that's where we were. In other words, this cartoon, there will be a bit of a wait while we figure out a market solution to your problem. But at the bottom line, the main thrust of the reform is that in spite of their market dominance, the health insurers, the slide that I showed that showed the private health insurance falling, the percentage of patients who have it, private health insurance has been losing market share. And private health insurance has become an unaffordable and defective product. It doesn't protect us from a healthcare crisis. It doesn't protect us from financial calamity. And the premiums are eating into what? Half of our median household income almost, right? So the magic of the marketplace, the idea was that if people were forced to purchase health insurance, then premiums for everyone would go down because the risk pool would expand for the private insurers. That's the theory of the individual mandate. And the individual mandate then will make underinsurance the norm because it doesn't take on the problem of how much these private plans cost. To try to make them affordable, we'll have bronze, silver, and gold plans. Bronze plans will pay 60% of expected healthcare costs. They say actuarial value. Silver will be 70% of actuarial value, and gold 80%. So it'll be a low premium, but a lot of out-of-pocket expenses. And so people can say that they have health insurance, but what our concern is that it won't protect our families against that calamity that comes along, which is the whole point of the insurance. Average employer plans presently cover 87% of actuarial value. So the point here for union activists is that our plans actually protect us from a healthcare disaster. Our health insurance seems to work on that level, but if the insurance pools that are being sold through the exchanges make the silver plan the most popular, then it would be likely to expect our employers to say, why don't you just go get the silver plan? It'll be cheaper for you, it'll be cheaper for us, and yet it won't cover us. So it's kind of a race to the bottom. The Affordable Care Act will cover these plans, but it eliminated copays and deductibles only on preventive services. So all kinds of user fees, copays, coinsurance, deductibles, are in play. And we're seeing this right now in upstate New York, where we've been talking with our hospital administration, Right now, our ER visits are down. The ER visits are down because people have new copays that are spectacular, $100, $200 to go to the ER, and so or more, and they don't go to the ER. But here's the interesting statistics. Our admissions are creeping up. So we have fewer people coming to the ER, but they're much sicker when they get there. And this is just an anecdote from our own ER. Meanwhile, in our society, incredible injustices have persisted. This is a famous study by David Satcher, who was Surgeon General under both Clinton and Bush. And his study showed that if African Americans had gotten the same care as whites in the year 2000, 83,369 fewer people would have died that year. Enormous racial disparities. This is right through the whole society. The shocking injustices persist. Medical deportations, patients who are undocumented immigrants getting sent to their home countries when they've had a healthcare disaster here in the United States. It's extra legal and absolutely shocking. I think for the trade union movement, that if we speak out for what it means for all working people, if we're talking about liberating the whole country here with basic economic rights, the right to necessary care, then we find a way forward for the whole trade union movement. And the unions, they have the expertise. They know how to lead us forward. They know exactly how to organize people, how to fight, and this is what it's going to take. It's going to take a fight. There's no shortcut. Now, the fact is that you can't jump over the class struggle. We have been taking a beating here for about 30 years. We don't have a labor party. We don't have a movement, a labor trade union movement that's growing and growing and growing. Our farms have become factories in the fields. Our farms have really become something that you can't even recognize, Education has become all this privatized gobbledygook and this mountain of debt on the young. So we've been getting pushed back and pushed back and pushed back. And you cannot just jump over that and get to something better because you have a good argument. Well, we have a very good argument. But here's something that's very interesting, is that we have such a good argument that we actually stay in the game. And they're constantly hollering on Fox News about how it's a government takeover, it's a government in other words, we're the enemy. We're the enemy that's being taken on, even though no one in the establishment seems to really have our back when it comes to it. And so what I would say to an audience like this is that where we're at, in my mind, is that we have to keep fighting and standing up and finding creative ways to make the case, to indict the failure of the system that we have now, and explain that we have everything that it takes to replace that with something that will absolutely work as minimum dignity for everybody. We can get there just like that. In Taiwan, the government was few years back, government was in trouble. They enacted single payer, and the government saved themselves, right? So we can do this. We can do this, and we should have that same perspective. But what I like to think about is a couple of examples from American history about how change, really happens sometimes. And when we think about the Democratic Party, I said, one doesn't know whether to laugh or cry about the Democratic Party, because is this the party of Franklin Roosevelt? Is this the New Deal Democratic Party? My governor is Andrew Cuomo. He blamed my public employees union for the whole state budget deficit. Our union was responsible for the whole state budget deficit. That was the attitude, And so you think about that history, when you look at the big reforms that took place in labor, we're talking the big reforms against child labor, the working day, the start of occupational safety, goes to the Triangle Shirtwaist Factory fire. And that was, right? Triangle, you could draw a line from Triangle to the Democratic Party that went to the New Deal in New York and New York City and that whole. But what is it that made Triangle so amazing was that these young women, 3 years earlier, 2 years earlier, 3.5 years earlier, were on strike against their employers because of the intolerable conditions that they were in the needle trades. They had these intolerable conditions. They went out on strike. The Tammany Hall Democratic Party went out and clubbed them down. And in that bloody battle, they got in the newspapers, and the conditions and the working conditions, the terrible working conditions, became part of popular consciousness in New York City. People were awake to the idea that these young girls were facing what they were facing. And so when Triangle happened, what was said on the lips of everyone in New York City, when you read the social histories, people said, those girls. They knew exactly what it meant to be locked up at work doing those terrible jobs, and they knew that a tragedy like this could happen. And that, I think, it begins to explain a couple of things. The Triangle Funeral March was the biggest mass event in New York City's history up until that time. Hundreds of thousands of people on the street to pay homage to these girls who had lost their lives. But this consciousness shifted, right? And I think that in our country, we already have the consciousness. I've talked to so many audiences where they say, well, you know, I don't think they're going to like what you have to say here, but, you know, but everybody feels it. The basic dignity requires health care in the modern era, and any democracy worth the name should provide it. That's the starting point among the American people. Something else is happening in the establishment. And so I think that if we persist, the crisis will come where we will be the obvious answer, and it could happen a lot faster than we could expect. You can't predict what else could happen. Yes, sir.